Hi, I'm Dr. Blair Masters with AccuSmart, and I've been doing a lot of philosophy, health philosophy lately, so I wanted to take a break from that and give you some like hard stuff that you could do to make your life better. Uh, One of the things that I wanted to talk about today was vitamin C. Vitamin C is one of the most underrated vitamins that you can take. You know, everybody sort of, oh, drink your orange juice and that sort of thing, and that's really not a great way to get your vitamin C. There's so much sugar in orange juice, it's crazy. But anyway, taking some kind of vitamin C supplement on a regular basis can make an enormous difference in your health. And humans are one of those animals that don't make their own vitamin C. There's lots of animals that make vitamin C, and like rats as an example. And if rats were around 150 pounds, their bodies would be producing around 10,000 milligrams a day of vitamin C. Vitamin C is good for practically everything. Now, I'm not recommending a 10,000 milligram a day dose on a regular basis for sure. There's some real problems with vitamin C taking a high enough dose to be effective, which I'll talk about here in just a second. But there's a great book available called Curing the Incurable by Thomas Levy, MD, Levy. I hope I'm getting his name right. Anyway, he goes into tons of research that's been done on vitamin C, how effective it is for the immune system, for all sorts of different infectious diseases. One of the things that they found, and this is a real issue, is that sometimes the need for vitamin C is so enormous to get the job done that you can't actually take it orally and get it into your blood. Your body will be like, that's too much, and give you diarrhea. If you're taking a dose that gives you that, then obviously you need to back off because you're beyond overdose at that point. Many of these studies were intravenous vitamin C, which it's sometimes difficult to find doctors who can do that for you. And I wouldn't even recommend that if you don't have some kind of, pretty significant infection or something like that. But something that you can do on a regular basis to help is to take a fairly high dose of vitamin C orally. 5,000 milligrams a day is a decent dose, especially if you're suffering from health problems. Many of my patients will take 7 or 8. I've had patients take 10,000 milligrams a day and not have any gut issues whatsoever and have benefits from it. But a 5,000 milligram a day dose, I take about 4,000 milligrams every day, and make sure that you're getting enough vitamin C because it washes right out of your body, and your body needs it for the immune system, it needs it for collagen production, it needs it for everything that goes on in the body. It is extremely important for so many processes. So taking a pretty significant dose of vitamin C every day is something that can really, really help you. One of the things about vitamin C is really fascinating that relates to the immune system that this book brought up, and that is some of these hemorrhagic diseases like Ebola, where Ebola you get the infection and you start bleeding out your nose and bleeding out your eyes, and oh my gosh, it's horrible, horrible. What the theory is, and it's a theory, is that your need for vitamin C skyrockets so badly when you have that sort of thing, but that basically you're in a situation where some of these hemorrhagic diseases are just an extreme case of scurvy, where the body just uses up all the vitamin C that's available. Your body can't produce any collagen to keep up with demands, and your body just starts kind of falling apart. I'm sure there's other factors that go along with that. But vitamin C is one of those things that you really should be taking a significant dose of, because you cannot get it anywhere but in your diet or in supplementation. So anyway, I hope this was helpful, and I appreciate you listening.